Looks like it might be working now. Um, Hi, my name is Snehal Desai. I'm going to talk to you a little bit about Baxfendy, a medication that's used for treating uncontrolled hypertension or high blood pressure, despite other medication that's used to lower it. The mechanism is distinct, or it's different from like other types of medications that normally binds to other types of receptors. Um, this one is specifically blocking an enzyme that produces a hormone that increases the blood pressure. So we're going to talk about how this works and tell you a little bit about this drug here as well. So this slide, you can see it's used to treat uncontrolled hypertension in conjunction with other antihypertensive medications. So what this means is that by itself, this may not be as effective. It's going to need other types of antihypertensive medications to help with the lowering BP effect. So it also belongs to a class known as aldosterone synthase inhibitor, and we'll get into that in a little bit. As you can see in the name, the aldosterone synthase ACE in the name is basically this is an enzyme. So it's going to inhibit this enzyme. And you could see the picture where mainly you could see in the picture this chemical element aldosterone, which is one of the main um, hormones that plays a role in terms of like blood pressure regulation and all of that. So you'll see in the next few slides a little bit more about aldosterone and the aldosterone pathway before we get into the medication mechanism part. So here is the aldosterone pathway. Well, before we even get into the aldosterone, um, it all starts from the adrenal gland, or the adrenal gland is basically sitting on top of the kidneys. Looks kind of like this image here. It's like a triangle shape. Um, well, not exactly, but you could see here like there's a capsule, there's the adrenal medulla, there's adrenal cortex. These two components, the adrenal medulla and the cortex, are very important things to know, not just for uh, this particular medication alone, but other medications that play a role with these parts of the adrenal gland. Um, the main focus here in this presentation is regarding the adrenal cortex, because that is typically where the aldosterone is produced. So the adrenal gland contains two parts. It's made of the inner and outer layer here, and the inner layer is the adrenal medulla, and it concerns mostly with the catecholamines, um, such as like epinephrine, norepinephrine, those kinds of things. The outer layer cortex, adrenal cortex particularly, is composed of three parts that involves different types of hormones. And these types of hormones are broken down to three parts here. You get the zona glomerulosa, which is where the aldosterone is produced as a mineralocorticoid hormone. Then you have the um, zona fascicular, which is where cortisol is produced, and then the zona reticularis, which is where the androgens are produced. So our concern is mostly going to be regarding this part here, the zona glomerulosa. So you can see here in this other picture on the right, I don't know if you can see it very clearly, but you can see the different types of hormones that are produced by the adrenal gland. broken down into three sections of the zona, glomerulosa, fasciculata, the reticularis, um, and you could see here a little bit of description of each here. The stress hormones, which is right here, and then the androgens as produced there, and then the glucocorticoids, and then the mineralocorticoids. So you could see there how that works. This other diagram is just a picture. I just wanted to show you all the processes where if the BP gets too low, how the whole process starts. Obviously, you could see here, it definitely starts with low BP. When the blood pressure gets too low, the kidney is going to release renin, so renin is going to be stimulated, increased. It's going to go out to a bloodstream. The angiotensinogen hormone that's produced by the liver is going to go through bloodstream, and it's going to be activated to produce. It's going to be produced by renin, which is the enzyme that's going to convert angiotensinogen to angiotensin 1. And angiotensin 1 is going to go to the lungs, and basically it's going to turn into angiotensin 2 by conversion via the enzyme ACE, angiotensin converting enzyme. And then angiotensin 2 is going to constrict the blood vessel, hence the vasoconstriction you see in the pathway there. And eventually it's going to go right to the adrenal gland. You could see the arrow pointing toward the adrenal gland, and it's going to release aldosterone, or stimulate the release of aldosterone into kidneys, and then bind to the mineralocorticoid receptor, retaining the water and the sodium, and decreasing the potassium. So that's how the overall blood pressure will increase. In general, that's how it would work here in this diagram. We'll take a little bit more on this in the next slide here. So, like I mentioned earlier, aldosterone stimulation mechanism. When BP gets too low, renin is released by kidneys. Renin converts the angiotensinogen to angiotensin 1. Angiotensin 1 is converted to angiotensin 2 by the ACE in the lungs. And the ACE enzyme converts it. And then you have angiotensin 2 that constricts the blood vessels and stimulates the release of aldosterone and retains sodium and water and excretes potassium. I have this other diagram here in case you wanted to see it a little bit differently as reference. Essentially, this is how it will work in the aldosterone pathway. Here's a bigger image on it. And you can see here that renin is right there, how it's kind of releasing it, going straight up to the bloodstream, and then angiotensinogen is converted to angiotensin 1 by the renin enzyme. And then this ACE, angiotensin converting enzyme, converts 1 to 2. And then the adrenal glands release aldosterone to elevate the blood pressure. And then, so how does Baxfendy work? So adrenal cortex functions to make aldosterone via the enzyme aldosterone synthase. So I will draw here a little diagram here. Let's make a different color here. We'll just assume that there is an enzyme, and this is called aldosterone synthase. Okay. So the adrenal gland, you have an enzyme that's known as aldosterone synthase. The Baxfendy, which is going to, I guess, this yellow color, Baxfendy is going to basically block that enzyme, and then less aldosterone is going to be released in the kidneys. And less aldosterone is going to reach the mineralocorticoid receptor in the kidney, and the blood pressure is going to decrease overall. So it's going to decrease BP overall. And so that means there's going to be less sodium reabsorption, less water retention, less blood volume, and less inactive activity, which is good. So what also happens? Well, at least there won't be a decrease in potassium levels. So that's another good thing here too. So Baxfendy is a pretty interesting mechanism. It helps with keeping blood pressure under control through a different mechanism. So that's another interesting fact here. So I hope this video helped you understand a new type of medication here that could help patients with keeping blood pressure under control. If anyone has any questions, please feel free to let me know. Again, thank you for watching this video. I hope you all have a good day.